You have to know that's a rib. Extra credit questions. True ribs, the first 7 ribs. And then false ribs, the last 5, the last 2 floating. That's the difference between the true ribs. True ribs have their own costocartilage connections. False ribs have their costocartilage joined together before they join the sternum, or if they're floating, they don't have any attachment. Parts of sternum you have to know: manubrium, top, the body, main portion, and then the xiphoid process. Scapula, and the glenoid cavity, coracoid process, the spine, and the acromion process. We don't have a clavicle here. Humerus, the head, anatomical neck surrounds the head, surgical neck is right there. Greater tubercle, opposite side of the head, lesser tubercle, anterior portion. Capitulum is the rounded condyle, trochlea, medial epicondyle, lateral epicondyle, olecranon fossa, large fossa on the back, posterior portion. Radius, the head of the radius, tuberosity, styloid process. Ulna, olecranon process, coronoid process, styloid process. Carpals, you have to know the name and number, the metacarpals and phalanges. You start the thumb is 1, 1, 2, 3, 4, 5. And that's it. First metacarpal, second metacarpal, third, fourth, fifth metacarpal. Phalanges are numbered the same way, 1 through 5. You have to know proximal, medial, distal. So distal is the end, the medial, proximal. The thumb only has a distal and a proximal, no medial. All right. Pelvis, you have to know ilium, the wing-shaped portion, acetabulum, iliac crest, articular surface for the sacrum, ischium, posterior portion, pubis, anterior portion, and then the obturator frame. Femur, the head, the neck, greater, trochanter, lesser, trochanter, lateral condyle, medial condyle. Patella, we don't have a patella here. Tibia, medial condyle, you know it's the medial condyle because you have the medial malleolus on the tibia. So medial malleolus, medial condyle, lateral condyle, tibial tuberosity, the bump. Fibula, you know, the head and the lateral malleolus. Tarsals, and the talus, the calcaneus, at the name and number, the metatarsals, and the phalanges, the same way you name the hand. So first, second, third, fourth, fifth, metatarsal, 1, 2, 3, 4, 5. For the phalanges, distal, medial, proximal, and then the big toe doesn't have a medial, just like the thumb, just has the distal and the proximal.